Hi, it's Barry Joyce from Smart and welcome to this video, and I'm going to try and give you some tips and tricks on how to pass a CSCS test. Now in this series of videos I'm actually going through the categories. Now as I've explained in previous videos, if you haven't seen them, out of the CSCS test there's approximately 710-ish questions, and out of those 610-ish questions, you're going to get 50. Pass mark is 45. Now, out of all the questions, out of the 50 questions you get, they are all broken down into these categories here, the 16 categories. In this video, I'm going to go through the dust and fumes, respiratory hazards. I'm going to try and get them all right for you and give you some tips along the way. Out of this category, you can get 69 questions. Look, there are 69 in this category. You're going to get 5 of these questions I'm about to show you over the next 30 minutes or so on your actual CSCS test. So he's away, and let's see what happens on this. Like every other mock test and category I do, I'll read the question and give you try and explain the right answer.
Which one of the following is true of repeated exposure to small doses of dust? It is unavoidable and harmless. Any effects will be immediately apparent. The effects will build up over time. It can help to build up immunity.
Yeah, of course, small doses of dust will affect you, and it will start to affect you with a build-up over time.
Before clearing up some rubble inside a building, why is it advisable to spray water on it? To prevent dust clouds, to kill any insects in it, to save time, so it doesn't make a mess.
Okay, yeah, of course, with damp spraying or damp cutting to prevent dust going into the air.
Which of the following do you not need to do to ensure that someone's mask works? Check the mask is being worn correctly. Check the mask underwater to make sure the seals are tight. Check the mask is the correct type needed. Check the user has passed a face fit test while wearing the mask.
Okay, so when you are wearing a respirator or RPE, you have to have a face fit test, but one thing you don't have to do to make sure it works is check it underwater.
What best describes how workers should treat dust? Assume dust is not safe wherever they are working. Assume dust is safe if they don't feel any ill effects. Assume dust is safe unless told otherwise. Assume dust is safe if they are working outdoors.
Okay, so whenever you see, it doesn't matter what category, always assume dust is present, always assume things are unsafe, always assume roofs are unsafe, always assume wires are alive until somebody's told you otherwise.
For the use of respiratory protective equipment, RPE, why is face fit testing important? To check that the colour matches work uniforms. To eliminate all accidents in the workplace. It ensures that the equipment will operate effectively. It means the equipment will need less maintenance.
Okay, of course you're going to do a face fit test to make sure it fits correctly and it's operating efficiently.
What system is a method of dust control? Damp extraction system, ducted heating system, humidifying system, on-tool extraction system.
So dust control is an on-tool extraction system. Just think of a Hoover bag.
If someone is using a petrol cut-off saw, disc cutter, to cut concrete blocks near to pedestrians, what 2 immediate hazards will affect the pedestrians? Harmful dust, flying fragments, vibration white finger, contact dermatitis, and electric shock.
Okay, so petrol cut-off saw. So pedestrians, the main effects are going to be dust and flying fragments. If you just have a look there, it's none of them would affect pedestrians.
Who can enter a confined space? Only site managers and supervisors of the company. Only competent machine drivers who have the correct license. Anyone who is trained, competent and authorized. Anyone who has completed an apprenticeship.
Okay, whenever you see the words trained, competent, authorised, pick it, always the answer, regardless of the category. Sometimes it might just say trained, it might say trained and competent, it might say trained and authorised or competent and authorised, pick it.
When using a power tool to cut or grind materials, why should the dust be collected and not allowed to get into the air? A machine guard is not needed if the dust is collected. Most dust can be harmful if breathed in. The tool will go faster if the dust is collected, to save time and avoid having to clear up the mess.
Yeah, most dust is harmful if you breathe it in.
What illness are you most likely to develop if you breathe in dust and fumes over long periods of time? Skin cancer, laryngitis, occupational lung disease, occupational dermatitis.
Okay, so it is occupational lung disease.
What is the main cause of long-term health issues in the construction industry? Being struck by a vehicle, breathing in hazardous dust and fumes, slipping and tripping, exposure to loud noise.
Okay, when you come to do your test, try to get your head around the difference between long-term, health issues and injuries. Injuries are through slips, trips, falls and falling from height and poor manual handling. Ill health is all caused through hazardous substances, dust and fumes, and also touching things with hazardous substances as well.
The use of respiratory protective equipment, RPE, is most likely required in which environment? Where work at height is being carried out. Where there is dust or fumes. Where heavy manual labour is required. Where there is excessive heat.
So your RPE, your respiratory protective equipment, is going to be where dust and fumes. So wherever you work with dust and fumes, you will need RPE.
After asbestos, which of the following causes the most ill health to construction workers? Resin, solvent and paint vapours. Silica dust. Wood and MDF dust. Diesel fumes.
Okay, after asbestos, so the next one, which will cause you the most ill health, is actually silica dust. It can be referred to as silica dust or silicosis. That's off brick dust. So any form of grinding, drilling, chasing out walls, sweeping up rubble will create silica dust.
Which two of the following are basic filter types used in respiratory protective equipment, RPE? Dust or particle filters, moisture filters, sound filters, gas or vapour filters, smell or aroma filters.
Okay, in this one it's dust and gas or vapours. Dust and particle filters are gas and vapour filters.
If you have been given a dust mask to protect you against hazardous fumes, what should you do? Start work without a mask, but take regular breaks outside. Wear a second dust mask on top of the first one in order to increase the protection. Do the job wearing the mask, but work as quickly as you can. Do not start work until you have the correct respiratory protective equipment, RPE.
Okay, in this situation then, you're just going to stop work. Again, anything that says stop immediately, stop, report it, stop, make safe is always going to be the answer.
What is the main risk to this worker wearing only these items of personal protective equipment, PPE? Goggles misting up, limiting vision. Not being able to hear colleagues. Breathing in harmful dust. Back injury from poor posture.
Okay, so these type of questions, you have to look at the image and just see what PPE they are not wearing, and it's very clear from here they are not wearing a respirator, so they're going to be breathing in harmful dust.
The seal between an item of respiratory protective equipment, RPE, and a worker's face is most likely to be affected by which two of the following? The wearer's age, dust levels, beard growth, sunlight, wearing safety goggles.
Okay, so what's going to break the seal around the respirator as you look at it? So in this case, it's going to be beard growth, and if you're wearing safety goggles.
What potential disease is this worker unprotected from? Nasal cancer, dermatitis, skin cancer, tetanus.
Okay, so again, you're looking at the image, not wearing a respirator, so it's going to cause nasal cancer.
Which of the following is not an immediate health effect of being exposed to paints and resins which have high levels of solvents? Headaches and sickness, muscular and skeletal disorders, drowsiness or poor coordination, dermatitis or skin problems.
So again, it's all about ill health, so solvents. So headaches and sickness, yes. Your muscular
and skeletal disorders
is your backs, your hips, so it's that.
A particle filter is suitable for use in which one of the following situations? An oxygen-deficient atmosphere, when dust and fibres are in the air, presence of gases, presence of vapours.
Okay, so again, particle filter, it's dust and fibres.
Which material or substance is most likely to give off hazardous vapour? Wet concrete, glue, dust, rubber.
Okay, a bit of a tricky one here, but it's a vapour. So the vapour out of these four is actually glue.
The chances of suffering from lung cancer are increased by what? Exposure to sunlight, exposure to steam, vibration from power tools, breathing in dust.
Lung cancer, yeah, breathing in dust.
Which of the following can be prevented by wearing respiratory protective equipment, RPE? Absorbing harmful radiation, inhaling dust and fumes, injecting hazardous liquids, absorbing hazardous substances.
Yeah, nice straightforward one. It's inhalation of dust and fumes.
Which of the following is true regarding harmful construction dust? It is usually a rust red colour. It can always be seen in normal light. It is often invisible to the naked eye. It always triggers hay fever.
Okay, in this situation, dust is actually quite often invisible to the naked eye. Yes, when you're sweeping or grinding or drilling, the immediate effects you would see the dust, but when it gets into the air, it's often invisible to the naked eye.
Which item of personal protective equipment, PPE, is helping to protect the worker from nasal cancer?
Okay, so it's the nose, so it's going to be the respirator, so it's protecting them. Again, with these type of images, make sure you click right on the respirator, because if you were to do that or something like that, you may just get it wrong.
Engine-driven equipment is being used in a deep excavation. Which of the following should be in place? Gas monitoring alarms, additional excavation covers, a vehicle marshal, additional stop blocks.
Okay, so engine-driven vehicles in an excavation. So an excavation is a confined space or a hole. You don't need a vehicle marshaller. You wouldn't need additional covers. Additional stop blocks would be used at the top if you're going to be reversing, so it's got to be gas monitoring alarms.
When is the best time to conduct face-fit testing for respiratory protective equipment, RPE? As part of the initial selection of RPE. After the RPE has been worn and used. In the morning before workers become sweaty. At the beginning of each new year.
Okay, so it's always going to be at the start of the initial selection.
Breathing in dust while using a cutting disc to cut through concrete could result in which of the following diseases? Leptospirosis, silicosis, legionnaires, asbestosis.
Rat urine, brick dust, contaminated water, asbestos.
Using water suppression to reduce dust will be most effective for which one of the following? Pneumatic chiselling of concrete, cutting plywood sheets, steel grinding, disc cutting steel.
Okay, so what's going to the dust is going to be chiseling of concrete or pneumatic drilling.
Asbestosis is associated with exposure to asbestos. Which part of the body does this disease affect? Feet, lungs, hands, brain.
Straightforward.
When drilling, cutting, sanding or grinding, what is the best way to protect your long-term health from harmful dust? Use dust extraction or wet cut and wear a dust mask. Use dust extraction or wet cut and wear FFP3 rated respiratory protective equipment, RPE. Wear any disposable respiratory protective equipment, RPE. Wear FFP3 rated respiratory protective equipment, RPE.
Okay, so the one that stands out is dust extraction, wet cutting, and have a face-fitted respiratory protective equipment.
Planned work requires the use of a power tool to cut or grind materials. Select the 2 best ways to control the dust. Keep the area clean and tidy. Wet cutting. Work slowly and carefully. Wear a dust mask. Fit a dust extractor or collector to the machine.
So what's going to stop the dust getting into the air? It's going to be wet cutting, and you're going to use a dust extractor. Just have a look at there. Them 3 are not going to stop dust getting into the air.
You have been asked to do some work that will create dust. What should you do? You should not do the work because dust is highly dangerous. Use equipment to eliminate or reduce the dust and wear the correct personal protective equipment, PPE. Start the work. No controls are needed as dust cannot cause serious harm or injury. Work for short periods at a time. Regular breaks will reduce the amount of dust you breathe in.
Okay, straightforward. Don't do the work. Oh, hold on. Let me select no. You've been asked to do some work that can create dust. What should you do? Use equipment to eliminate. Guys, I've just switched off there for an absolute. So you're going to use equipment to eliminate or reduce dust. Yes, that's going to be the one there. Dear God. Yeah. Okay, so focus.
What can cause occupational asthma? Breathing in hazardous dust, fumes or vapours. Exposure to rat urine whilst working. Exposure to loud noise on a regular basis. Skin contact with any hazardous substance.
Of course, it's going to be that one. Rat urine, leptospirosis. Hearing problems is tinnitus, and contact hazardous substance will cause dermatitis.
Respiratory protective equipment RPE fit tests should be carried out by whom? A supervisor in compliance with the law. The worker who will carry out the work. A competent person in compliance with the law. The manager overseeing the work.
Okay, so the word competent is in there, so I'm picking it.
What should you do if you find lots of old bird nests and droppings in an area you are working in? Stop working and speak to a supervisor to arrange for decontamination work. Carry on working and work around them. Sweep them up and put them in a bin liner immediately. Check there are no live birds present, then carry on working.
Yeah, okay, so a lot of people would just crack on, sorry. So bird nests and bird droppings is highly toxic, or bird droppings should I say, highly toxic. So you're going to stop work. Again, remember the key word there, stop work immediately, report it to your supervisor.
How is occupational asthma commonly caused? Excessive manual handling, inhaling construction dust, working overtime, working alone.
Straightforward.
Which of the following activities does not create harmful silica dust? Chasing out walls and mortar joints or sweeping up rubble. Sawing timber or plywood. Cutting curbs, stone, paving slabs, bricks and blocks. Breaking up concrete floors and screeds.
Okay, so silica dust, which will give you silicosis, is anything through brick, dust and water. So anything that's not that, which is timber wood, again read the question, will be the answer.
Which kind of personal protective equipment, PPE, can protect your lungs from harmful vapours? Ear defenders, hard hat, goggles, respirator.
Straightforward.
What is the best way to limit exposure to dust when using a power tool? Do the work quickly. Stand downwind of any dust. Stop dust getting into the air. Use the tool during wet weather.
Yeah, of course, we're going to stop the dust getting into the air.
Which of the following two options are likely to cause the most dust exposure? Using hand tools outside. Working with wet or damp materials. Using power tools without extraction. Using power tools with extraction. Working with dry materials.
Again, look, read the question. Which one will cause the most, is likely to cause the most exposure, the most? So what's going to cause the most dust? It's going to be working tools without an extraction and working with dry materials. Yep.
What is the most important consideration when wearing respiratory protective equipment, RPE? Being able to smell. The weight is correct. It is the correct colour. It has a good seal.
Of course, it needs a good seal.
Why is it important to be clean-shaven when using a half-mask respirator? You will be able to use the same mask for longer. Facial hair can block the filter more quickly. You may suffer an allergic reaction to the mask. Facial hair can affect the seal around your face.
Okay, so we've already had a similar one. What can affect the seal around it? And it is beard growth. So it's going to be facial hair can affect the seal.
What can wearing respiratory protective equipment, RPE, prevent workers from? Vertigo when working at height, breaking bones, noise pollution, breathing in dusts and fumes.
Yeah, straightforward.
Which of the following could ignite flammable vapours? Select 2 answers. Naked flame, oxygen, carbon dioxide, sparks, water.
It's going to be the top two, naked flame and oxygen. It's your fire triangle. Fuel, oxygen and heat. Could ignite. Yeah, no, it's totally wrong. It is sparks and that. Yeah, I'm thinking the triangle. So, yeah, again, just switching off for a moment. So, which could ignite. So, it is a spark and a naked flame. Part of your fire triangle, sorry, is heat, oxygen, and fuel. That's where I got myself a little confused. But again, I've read the question again properly, and I'm happy with that.
Which of the following statements is true about respiratory protective equipment, RPE? It will always cause facial bruising to the wearer. It will only be effective if it fits the wearer's face. It will only be effective if the equipment can be loosened. It is a one-size-fits-all piece of equipment.
Okay, so the true statement there, of course, it's only going to be effective if you've had the face fit test to fit the wearer's face.
What should you do if you run out of the water you are using to control dust? Ask everyone to clear the area and then carry on. Put on additional respiratory protection. Carry on, but get someone to sweep up afterwards. Stop and refill the water.
Stop. Always.
Which of the following best describes carbon monoxide? Colourless, odourless, poisonous gas. Another name for oxygen. A gas similar to methane. Odourless, harmless gas.
Carbon monoxide, it is, you can't smell it, you can't see it, it's highly dangerous, known as a silent killer. So it is that.
Exposure to which of the following is unlikely to result in lung disease? Asbestos, silica dust, bird droppings, strong smells.
So which is unlikely to result. That will. I mentioned before, bird droppings will. So it's just strong smells. Strong smells could be anything.
What is the most serious risk to this worker wearing only these items of personal protective equipment, PPE? Goggles misting up, limiting vision. Back injury from poor posture. Not being able to hear colleagues. Breathing in harmful dust.
Okay, another one, not wearing respirator, so it's breathing in harmful dust.
Which one of the following statements about respiratory protective equipment, RPE, is true? Workers should provide their own. Employers must supply it at cost when it is needed. Employers must supply it free of charge when it is needed. Workers should share the cost with the employer.
Okay, so it's a bit similar to your PPE, and again, I do appreciate sometimes this not always the case, but for your CSCS test, the employers must supply it free.
When workers use respiratory protective equipment, RPE, they should have a face fit test. Why is this? To ensure the mask looks right. To ensure the mask fits and functions correctly. To ensure the selected mask is the correct colour. To make sure that the mask fits the budget.
Yeah, nice straightforward. You're going to make sure it fits you, so it's all functioning as well.
The inhalation of construction dust can result in which one of these diseases? Tonsillitis, swine flu, silicosis, leprosy.
Okay, you should know by now, silica dust will give you silicosis, or could cause silicosis, sorry.
What must you do when using water to keep dust down when cutting? Ensure that there is as much water as possible. Pour water onto the surface before you start cutting. Make sure that the water flow is correctly adjusted. Get someone to stand next to you and pour water from a bottle.
Yeah, of course, you're going to make sure the water flow is correctly adjusted.
What should you do if you need special respiratory protective equipment, RPE, to handle a chemical, but no RPE has been provided? Do not start work until you have the correct RPE and training. Start the work, but take regular breaks to reduce exposure. Get on with the job, but try to work quickly to reduce exposure. Sniff the substance to see if it makes you feel unwell.
Really? Yeah. These are genuine questions.
What is the main risk to this worker wearing only these items of personal protective equipment, PPE?
Okay, so we've had about 4 of these different ones. I'm not going to bother reading the questions out because we know it's breathing in dust because they're not wearing a respirator.
How should water be used to reduce the level of dust when cutting concrete using a cut-off saw? Enough to make the first cut, then no more will be required. Constantly the whole time the concrete is being cut. Enough to wet the surface of the concrete before cutting. Constantly until you are halfway through the concrete cut, then stop.
Yeah, of course, it's all the time whilst you are cutting.
Where are you likely to be exposed to the highest quantities of dust when drilling, cutting, sanding or grinding? Outside on a windy day. Inside a small room. Outside on a still day. Inside a large space.
Yeah, straightforward.
A construction worker has been exposed to concrete dust for a long period of time. What are they most likely to suffer from? Headache or migraine? Shortness of breath, blurred vision, hearing problems.
Yeah, of course, it's going to be shortness of breath because it could give you occupational asthma.
Hydrogen sulfide is a gas given off by rotting organic substances. Which 2 statements are true about hydrogen sulfide? It is dark brown at room temperature. It can cause unconsciousness in a few breaths. It is a harmless natural gas. It is dangerous because it can disable the sense of smell. It can safely be detected by using a naked flame.
Okay, so hyposulfate can make you unconscious in a few breaths, and it is dangerous because it can disable your smell.
When fumes are present, which is the most dangerous area to work in? On-site, outside, in a wooden building, a confined space, an open space.
Straightforward, confined space.
Pigeon droppings and nests are found in an area where you are required to work. What should you do? Wait for the pigeons to fly away before carrying on with your work. Stop work, do not touch anything and seek advice. Carry on with your work carefully so you don't disturb them. Try to catch the pigeons so you can move them out of the way.
Catch the pigeon. Of course, keyword stop. Good luck catching a pigeon, by the way.
How often is it good practice to carry out repeat face-fit tests for respiratory protective equipment, RPE? On an ad hoc basis. When starting work on a different site. When starting a new shift pattern. On a regular basis.
Yeah, you're going to do it on a regular basis, aren't you?
Which 2 factors determine the appropriate type of respiratory protective equipment, RPE, to be used for a job? Whether the RPE is made of rubber or plastic. The amount of time since a hazardous spill. The type of hazardous substance. The amount of hazardous substances in the air. Whether the worker wants to wear RPE or not.
Well, it's got to be those 2 there, so the type of hazard and the amount of hazardous substances in the air.
The seal of your respiratory protective equipment, RPE, can be broken by which 2 things? Facial hair, a hearing aid, earrings, makeup, facial scarring.
Okay, so just remember what's going to break that. So we know facial hair or beard growth. And the other one actually is facial scarring. You know, any type of facial scarring will break the seal on your respirator.
Which one of the following is the most serious consequence of regularly breathing in construction dust? Life-shortening illness, collapsed lung, having to take time off work, getting asthma.
So one of the following is the most serious. So the most serious is, to me, it's a short life-shortening illness.
When working with materials creating dust, what should be monitored? The smell the dust creates, the level of exposure to the dust, the direction in which the dust travels, the colour of dust created.
It's going to be the levels of dust.
If your respiratory protective equipment RPE is a bad fit, which one of the following is most likely to happen? It will filter more air. It will not protect you. It will break easily. It will get damaged.
Of course it is.
How should contaminated respiratory protective equipment RPE be considered when being disposed of? As hazardous waste, as compostable wastes, as normal waste products, as recyclable materials.
So contaminated, it's hazardous. So as you know, we need to segregate things, so it goes as hazardous waste. Okay, so that's your 69 questions. Okay, so them are the 69 questions, quite a long category, but you are going to get 5 of those 69 questions you've just seen there. Read the questions, think about what we've just talked about there. The biggest form is getting stopping the dust getting into the air, the silica dust, which will give you silicosis. So yeah, just make sure you read the question properly. I hope you're getting a little bit out of that. As I said, it's a lengthy, I think it's the 3rd biggest one out of all categories. But I hope you're getting something out of it, and I look forward to seeing you in the next video.